Lou Gehrig was a famous New York Yankees baseball player, born June 19, 1903 in New York City. He won the Triple Crown in 1934 and was voted Most Valuable Player in 1927 and again in 1936. In 1938, Lou Gehrig hit an all-time low since 1925, and on May 2nd of 1939, a game announcer declared his consecutive 2,130 game streak had ended, and that's when Lou was diagnosed with ALS, which is a very rare and degenerative disease. He would never play again. He died on June 2nd, 1941, just shy of age 38 from ALS, which is the disease we're about to discuss. And here we've got a picture of Lou Gehrig. ALS is known as amyotrophic lateral sclerosis, more commonly referred to as Lou Gehrig's disease. It affects the nerve cells in the brain and spinal cord, which controls voluntary muscle movement. There's three kinds classified at this point: sporadic, which is the most common, affecting 90 to 95% of cases; familial, which is 5 to 10% of affected cases; and then there's another called Guamanian, where a high incidence was observed in Guam and the U.S. territories in the 1950s. With ALS, a small percentage is genetic and the remaining causes are unknown. For a broad generalization of the disease, nerve cells basically waste away and die, making it impossible to send messages to your muscles. Eventually there's an inability to move your arms, legs, or body. Once the disease progresses enough, chest muscles stop working, and it makes it impossible to breathe on your own. Here we have a picture of the nerve cells from ALS. Here you can see this is a regular nerve cell for your muscles, and here's an affected nerve cell that is ALS affected. Symptoms generally don't develop until later on in life. The basic initial symptoms would be loss of muscle strength and coordination. It affects little things such as getting out of a chair, walking, swallowing. Breathing and swallowing are generally the first things that are affected. The next topic that we'll go into is treatment. There are no known cures for ALS. However, there are drugs that can slow progression. One that I came across was Riluzole. Some others that really help are diazepam, which controls spasticity. That's better understood as stiff or rigid muscles with an exaggerated deep tendon reflex, like a knee-jerk reflex. There's also amitriptyline, which helps with problems with swallowing saliva. Patients with ALS generally progress to a feeding tube to avoid choking, as choking is very common in ALS patients. They also tend to lose weight very rapidly, as the illness itself creates an increased need for food and calories. But they tend to lose weight because they choke on it and can't swallow it. One medical article that I came across was about how mild obesity tends to improve survival in patients with ALS. Generally, patients that are underweight or just at normal weight, they tend to not survive as long as patients who have mild obesity. In closing, we'll cover the prognosis and some notable people that have the disease. People lose the ability to function and care for themselves as the disease progresses very rapidly, and death often occurs within 3 to 5 years of your diagnosis. It's very, very rare that a patient with ALS would survive more than 5 years from diagnosis. If you think you or someone you know may have ALS, you can have your healthcare provider perform a physical strength and endurance test. Some tests that they include would be, to rule out mimicking diseases, would be breathing and blood tests, a CT or an MRI, genetic testing, a spinal tap, and sometimes they do swallowing studies. ALS is not a very well-known disease. It's very rare. Doesn't affect very many people. However, there are some very famous people that have ALS. One would be renowned scientist Stephen Hawking, of course Lou Gehrig, who the disease is named for. Also Jason Becker, who was a famous neoclassical metal guitarist. He was part of David Lee Roth's solo band. And also Orlando Thomas from the Minnesota Vikings. And here we have some pictures of them if you're not sure who they are. As you can see, Jason Becker has a feeding tube in his throat. Orlando Thomas, I couldn't find any pictures of him without, with the disease. And then here's Stephen Hawking. You can see he's in his wheelchair. If you have any questions about ALS, you can go to alsa.org. I found that website very helpful. You can also go to mda-als.org. That's another website that I found helpful for this.